If you have scrolled through Instagram or TikTok lately, you have almost definitely seen it. People wearing glowing robotic face masks. Athletes sitting in rooms that look like the inside of a toaster. It's called red light therapy, and at first glance, it looks like classic wellness snake oil. We are used to the idea that light can damage our skin. That is why we wear sunscreen to block UV rays. So the idea that blasting yourself with bright red lamps could actually fix wrinkles, heal muscles, or lower inflammation feels counterintuitive. But if you dig into the peer-reviewed literature, you find something surprising. This isn't magic, it's physics, and it actually starts with NASA. In the 1990s, NASA scientists were trying to figure out how to grow plants in space. They used red light-emitting diodes because they were energy efficient and emitted the specific wavelengths plants need for photosynthesis. But the scientists noticed something else. The small cuts and scratches on their own hands were healing faster while they handled the lights. This kicked off decades of research into what is technically known as photobiomodulation. To understand how it works, you have to zoom in, way in, past the skin, past the tissue, down to the cellular level. You probably remember from high school biology that the mitochondria is the powerhouse of the cell. Its job is to create ATP, adenosine triphosphate, which is essentially the energy currency your body runs on. Here is the mechanism. Deep inside your mitochondria, there is an enzyme called cytochrome C oxidase. Its job is to accept oxygen and help churn out energy. But when you're stressed, tired, or injured, that enzyme gets clogged up by nitric oxide. It's like throwing a wrench in the gears. The cell stops producing energy efficiently, and you get inflammation and cell death. This is where the light comes in. Not just any light, though. It has to be very specific wavelengths, typically between 600 and 850 nanometers. Red light hits the skin surface, while near-infrared light travels deeper into the muscle. When these photons hit that clogged enzyme, they knock the nitric oxide out. The wrench is removed. The gears start turning again. The cell goes back to efficiently producing ATP. With more energy, the cell can repair itself, replicate, and function better. So, does it work? The data is surprisingly strong, specifically for two things: skin health and muscle recovery. Multiple meta-analyses have shown that red light therapy boosts collagen production, reducing wrinkles and scarring. In the gym, it helps clear out metabolic waste, reducing soreness after workouts. But there is a massive catch. It comes down to dosage. You cannot just screw a red party bulb into a lamp and expect miracles. The clinical effects depend on the intensity of the light, called irradiance, and the distance from your body. Too little, and nothing happens. Too much, and you can actually inhibit cell function. It follows a biological law called the Arndt-Schultz rule. There is a Goldilocks zone where the therapy is effective. Red light. Therapy isn't a cure-all. It won't replace sleep, exercise, or a good diet. But, unlike so many trends in the wellness space, this one isn't built on vibes. It's built on the fundamental way our cells interact with energy.